everyone, welcome to Hiranya Medical Service. Live a Smart Life Doctor Series Episode 3. Today, Dr. Tan, a dentist from Singapore, will be talking about missing teeth and implantology. Dr. Tan Min Seet obtained a Bachelor of Dental Surgery from the National University of Singapore in 1995. He went on to specialize in the field of oral and maxillofacial surgery and acquired his master's in 1998. He was trained in minor surgical procedures such as wisdom tooth operation to tumor and orthognathic surgeries management of the maxillofacial region in the Accident and Emergency Department. In 1998, he was also conferred fellowship in the Royal College of Surgeons, United Kingdom, England. After graduation, Dr. Tan founded his own private practice while still actively involved in other reputable and major chains of clinics island-wide. He was a part-time tutor in NUS and attended night calls at the A&E department of the National University Hospital and Mount Alvernia Hospital. While in private practice, Dr. Tan took special interest in implantology. He was certified by the Interdisciplinary Dental Education Academy in San Francisco, California, USA in 2004 as a certified implant trainer. In 2005, the Bicon Implant World Symposium appointed Dr. Tan as the representative of Singapore and the region. He was also appointed as a member of the Scientific Program Advisory Committee. Apart from the clinical practice, Dr. Tan is an advocate for experiential learning. By setting a platform for healthcare specialists to interact and share, the goal is to encourage industry, sharing, and learning. As a course instructor, he imparts his experiences and knowledge to both local and foreign healthcare specialists.
Okay, thank you, Hiranya, for inviting me to this platform, the Hiranya Medical Service. And I believe the module that I'm on is Live a Smart Life. And before I accepted this invitation, I did a little bit of research and realized that Hiranya is a young medical student with full of energy, doing some altruistic work, trying to get some oxygen with the Oxygen Life Support Project and doing some medical education. So with that, then I will look for a topic for her to present, and my topic will be missing teeth, missing out in life. I'm a dentist and my profession is maxillofacial surgery and I do surgical work. So I thought the best topic that I would have would be missing teeth, missing out in life. So that will be my topic, and I will discuss on why having teeth is important and why missing out teeth will give you trouble. So what are the various options that's also available when you have lost your teeth? So if you look at this slide of an artifact, this is dated as early as 600 AD and is an archaeological artifact of a mandible where there's 3 teeth actually missing. So in those days, in the early days, people already tried to have teeth. People want to have teeth. So if you see that the 3 arrows actually indicated a missing teeth. And what they do was to try to shape a shelf tooth that looked like a tooth and literally shove into these 3 missing sockets so that they could have teeth and they could smile and eat normally. And can you imagine in those days where they don't have anesthesia, people were desperate to have teeth in those days and they want to have teeth. So that's how important our teeth is. So let's take a look at why having teeth is important. There are various functions of having a tooth. For the first most important function is to be able to eat. So we want to chew our food. We want to be able to chop our food into pieces so that we can swallow down. So unable to bite properly, unable to grind your food, then will give you a lot of indigestion. So the first function will be to be able to eat. And we also want to look good, especially in today's context. We want to look cosmetically good and be presentable to the public as we talk. So the teeth, especially the front teeth, is important for us. It is also important to talk. So the teeth provide a seal so that we can talk and pronounce properly. Without the teeth, then there will be leakage when you talk and the pronunciation will not be accurate. So can you imagine if you have a missing tooth right in front and when you start talking, there will be a lot of leakage, and worse still, sometimes the saliva starts spitting out and you get into your audience. So that's not so nice. And not many people know that having tooth is also important to maintain space. As this slide has shown, the teeth is missing and we need to replace back a tooth on the same place. Having a missing tooth as it is will allow the adjacent tooth to start drifting and moving. And from this slide, as you can appreciate, the teeth start drifting into the space, and then we have the rest of the teeth bound aligned or some gaps in between. So that's the last thing we want to happen. Now, what are the then various options that we have for the tooth replacement therapy? We can always do nothing. That means we don't do any treatment at all and bear all the consequences that we have just discussed earlier. We can also have a denture, which is a removable option. This denture is a plastic piece with a tooth on top, and this will then sit on the missing gap, missing space to replace the missing tooth. So it is a removable prosthesis that can be taken out and replaced back anytime you want to wear. We can also have a fixed bridge. So what is a fixed bridge? A fixed bridge is to use the adjacent existing tooth to cut this existing tooth so that we create a space. With this space, then we can then fabricate a new tooth over this space. And if you look at this slide, that's what we do in the lab to create a 3 teeth all joined together in one piece and then seated onto this adjacent tooth. So the adjacent tooth helps to anchor the missing tooth. So what you actually have is a tooth on top, but there is no roots at the bottom supporting. The supporting tooth will then be the adjacent tooth that is actually supporting it. And today's context, I think many people are interested in dental implants. And what are dental implants? It's literally having back a tooth where it is being placed onto the bone. So implantology is the new treatment options that we have for patients today. So what are dental implants? If you look at this slide, they are actually a man-made artificial tooth, and the material that we use for these dental implants are usually titanium. And why do we use titanium? It's because titanium is very biocompatible with the body. The bone likes it so much that it grows and fuse to the material, which is titanium. And this is discovered in the early days by Professor Brandemark. I give you a little bit of the history of what dental implants is about, where he chanced upon a project where he placed a titanium device onto the bone, and when there was heat transmitted to this titanium, it burnt the bone. So when that happens, he was called up and he went to inspect, and the rest was history. He realized that the titanium actually fused to the bone. So that's how the term osteointegration actually is being coined. And that was the landmark in the dental revolution. Everything changed and the treatment options are much better now. So to give you an idea of what a dental implant is about, there are 3 parts to the implant. There is the dental implant fixture that goes inside the bone to anchor onto the bone. And then we have something sticking out, which is the suprastructure, and that's called the abutment. And finally, with this abutment, we will then fabricate a crown over this abutment. So this crown is a tooth-like structure that gives the patient a chance to have another tooth back. So how this whole process goes is a little bit more complicated than the simpler options. Now we have an option of inserting the implants in first and then putting on the abutments before we fabricate the crown. So we can actually do this in 2 stages, in which the implant fixture goes into the bone first, and then wait for 3 to 6 months, depending on situations, before we put the abutment on. And with the abutment, then we will fabricate a crown. Or we can choose to have a 1 stage where the fixture and the abutment is being placed together, and then we wait for 3 to 6 months, again depending on the situations, before we come back to put the crown. Or we can put the fixture in, the abutment in, and the crown in, the 3 pieces all in together in 1 sitting. And this is what we call tooth in a day. Now, obviously, we prefer to have everything done in 1 go, in the fastest manner, but it is not always possible for every situation. So we will always advise that you seek your own dentist to discuss the various options and which is the best and most suitable for yourself. Now, having known all this, then which are the options that is best for you? We now take a look at the advantages and the disadvantages of the various options. The first option will be the dentures, and the advantage of having a denture would then be it's a very cost-effective way of a tooth replacement therapy. It's obviously cheaper than the bridge and implant option. It is also very convenient because it is removable. You can take it out anytime you want, and you can wash it as and when you need it. It is also very quick to fabricate as compared to dental implants. We can send it to the lab, and for a simple partial denture, we can have it within a week or 2, or a full denture sometimes up to a month. The disadvantage, however, is it's going to be inconvenient because you need to remove and take it out for washing. It's also very cumbersome. It's big. A big piece of plastic will then have to be placed inside the mouth. So it becomes very uncomfortable for the patient because of this bulge. It is also easily fractured, especially when you drop it or when you flex it, it may just crack and fracture off. He has also retention issues, and that is why people who are on dentures, when they speak, sometimes if the denture is loose, it may fall off, or when they are eating, it may just drop it out. The last disadvantage would then be the replacement. Because this denture actually sits onto the gums and below which is the bone. So with the constant impact, the bone will then start to resorb, start to shrink. And because the bone shrinks, then the denture become ill-fitting. So you need then to replace this denture every few years so that you get a nice fitting denture. The option of a bridge has also advantages and disadvantages. It is also relatively cost-effective as compared to dental implants, because dental implants are, of course, expensive. It is, however, cheaper than dental implants, but more expensive than the dentures. It's also quick to fabricate because we can just cut the tooth on the same sitting, take a mold, send it to the lab, and fabricate a bridge to sit on it. Then we come back to the patient and cement the whole bridge. It is also comfortable because it looks very much like the tooth replacement. Each tooth is replaced by itself, and it's comfortable for the patient. It is also convenient by the fact that it is actually a fixed prosthesis. You do not need to take it out, and you don't have issues of misplacing them. However, the disadvantage would then be you require sound teeth structure. The adjacent tooth requires to be healthy and sound so that you can use it as an anchorage. And if you are using a healthy tooth, you are now then damaging this adjacent tooth by cutting and shaving out the first layer of the tooth so that you create space for the bridge. It is then also not very suitable if it's going to be a terminal tooth, which means this is going to be a last tooth, because then we do not have another tooth to support at the most back end. Now, then we look at the advantage of dental implants, which is the choice treatment like most people think today. It is comfortable because it is a tooth replacement by itself, the same tooth that's been replaced. It is so convenient, it is fixed like the fixed bridge. And the best thing is when we place the dental implants in, we want to preserve the bone. By not doing a dental implant, then the bone will start to shrink. It's a very natural phenomenon because the body detects that there's no more function and it starts to shrink. So that is a very natural phenomenon that happens if you do not have an implant replacement. The disadvantage, however, would then be it is going to be a very costly exercise. You are going to spend more for dental implants than the rest of the early options. And it is also dependent on the bone, the available bone that is present. So if there is not enough bone or there is severe bone resorption, then we will have an issue to put dental implants. We would then have to think of other options like bone grafting to add and to puff up the bone at that particular area. So what are the prerequisites of having a dental implants if you need one? It will then, of course, be having sufficient bone. So this word osteointegration is the essence of having a successful dental implant. You need to have sound bone surrounding and wrapping up the whole dental implants to have a good long-term success for the dental implants. So if you do not have enough bone, then it will be much more complicated and we have to deal with some bone grafting procedures. We will have also other limitations like the anatomical hindrance, where we have some sinuses in the maxilla, the upper jaw. We have also the nerve and the lower jaw, and this will prevent us from putting a long and deep implant if we require. So this is in a nutshell what dental implants are all about, but I think every situation is very different. You need to consult your dentist to understand more and discuss with him the various options that you have and what is best for yourself. So from this, you will appreciate why having teeth is important, and you need to maintain your teeth. Your own natural teeth is always the best tool that you have. So please brush your teeth every day, once in the morning and at least once in the night before you go to bed. Thank you.